Right, we're going to talk about the cardiovascular system and the lymphatic system. So the cardiovascular system is going to be the heart and the blood vessels associated with it, as well as the blood itself, the plasma and cellular components that are found in our blood. We are also going to talk about the lymphatic system here because it is closely tied to the cardiovascular system, but it is a completely separate system. All right, let's start off with some anatomy. So the heart is actually going to be located in your chest cavity between your lungs. If you find your breastbone, that is the mediastinum, come down towards the bottom, your heart is going to be initially located under there and then protrude out into the left side, into the left lung, pointing at a downward angle. The pointed apex, which is also the bottom of the heart, will be pointed towards your left hip. The heart itself is less than a pound in weight and approximately the size of your fist. Here we have the heart and blood vessels coming off of it. We'll talk about those in a second. The heart itself has a double layer membrane surrounding it. This membrane is referred to as the pericardium. The inner portion of that membrane is referred to as the visceral pericardium. Also, the epicardium is another name for it, and that's the layer that's located next to the heart. The outer layer, the layer located closer to the ribs, is referred to as the parietal pericardium, and located between these two spaces is going to be serous fluid. Think of serous fluid as lubricant. It helps to make sure everything is going to glide over each other smoothly. The heart itself is composed of 3 layers. That outermost layer is going to be the epicardium, so also the visceral pericardium, and is a connective tissue layer. The middle layer is our cardiac muscle tissue, and then the inner layer is a endothelial tissue. Here's an artistic rendering of all those layers. Artistic rendering of the cardiac muscle tissue and microscope image. Another image. All right, so the heart is going to have 3 sets, technically 2, of major arteries and veins coming off of it. The first set is going to be the pulmonary arteries and veins. The pulmonary arteries and veins are going to carry blood to the lungs and then back to the heart. We can see that right here. This right here is the pulmonary trunk, which will branch into the right and left pulmonary artery. Now, you might be thinking to yourself, wait, it's blue, not red. It's an artery. According to earlier education that you probably received, you were taught that arteries are red and veins are blue. This is incorrect. The reason for that coloring is red is used to denote oxygenated blood and blue is used to denote deoxygenated blood. However, the pulmonary arteries carry deoxygenated blood. This is why they are blue. These back here are the pulmonary veins, the right ones and the left ones, and they are going to carry oxygenated blood. So on artistic imaging, they're denoted red. The best way to remember what an artery and a vein does is to remember that arteries always carry blood away from the heart, while veins always bring it back. Here we have the aortic arch. The aortic arch is the primary artery coming off of the heart, and it is going to carry blood to the rest of the body. Now, however, when it first comes out of the heart, it's going to have a branch that comes off of it immediately, and you can't actually see that in this image. That first branching is going to lead to the coronary arteries. These arteries are going to supply the myocardial tissue with oxygen and nutrients and take away waste products. The blood does not get its oxygen and nutrients from the blood that's in the chambers within it. Those are kept separate. The blood cannot bleed out of those chambers due to that endothelial lining, unless there's something drastically wrong. So in order for the cardiac muscle tissue to get oxygen and nutrients, we have to have these coronary arteries. And then the blue is the coronary veins, which are going to bring the waste products back into the cardiovascular system over here. And I'll talk about these two guys right here. So it can be recycled and get rid of its waste and pick up oxygen. So here we have the aortic arch. As it comes up and over, it's going to bend back behind the heart and then travel along the spine down through the thoracic cavity into the abdominal cavity, and we'll talk about it more there. However, as it's in its arch phase at the top, the first splitting will be the brachiocephalic artery, and that's going to carry blood to the right side of the head and neck and arm. And then we're going to have the left common carotid artery, and that's going to carry blood to the left side of the head, and then the left subclavian artery, which will carry blood to the left arm. Over here, we have the superior vena cava, and this is the primary vein, one of the largest veins in the body, and it is going to collect all the blood from the upper portion of your torso. Down here is the second largest vein, and that is the inferior vena cava, and that is going to collect all the blood from the lower portion of your body, bringing it all back to the heart. The heart has 4 chambers, 2 on top, 2 on bottom, 2 on the right, 2 on the left. These 4 chambers are the atria on top. These are receiving chambers. The right atria is going to receive blood from the body, and the left atria is going to receive blood from the lungs. On bottom, we're going to have the 2 ventricles. These are referred to as the discharging chambers. The right ventricle is going to pump blood to the lungs, and the left ventricle is going to pump blood to the body. Again, aorta leaves the left ventricle. Pulmonary arteries leave the right ventricle. The vena cava enters the right atrium because it's returning blood from the body, and the pulmonary veins, there are actually 4 of them, 2 from the right, 2 from the left, are going to enter the left atrium, bringing blood back from the lungs. The cardiovascular system is actually divided into 2 circuits, the pulmonary circuit and the systemic circuit. So the circuit to and from the lungs and the circuit to and from the body, but we'll talk about that in more detail in later slides. This particular image, this slide, is repeated multiple times throughout this PowerPoint, so you will see it frequently. Now located within the heart, there are 4 valves. Valves are important. They help prevent backflow and keep blood where it's supposed to be. So we have 4 valves. 2 are found between the atria and the ventricles. So we have a right AV valve and a left AV valve. The right AV valve is the right atrioventricular valve, also referred to as the tricuspid valve because it has 3 flaps, and it helps make sure that the blood in the right atrium does not move into the right ventricle until it is supposed to, and that blood in the right ventricle does not back up into the right atrium. The left AV valve, or left atrioventricular valve, is referred to as the bicuspid valve because it has 2 flaps and it does the same thing, only on the left. Then at the end of each ventricle, or the exit to each ventricle, I should say, there will be a semilunar valve. The semilunar valve between the right atria and the pulmonary valves is going to be referred to as the pulmonary semilunar valve, and the valve between the aorta and the left ventricle is going to be referred to as the aortic semilunar valve. And you can actually see those right there. Now, attached to the AV valves, atrioventricular valves, you will have tendons that are referred to as chordae tendineae. And those chordae tendineae are attached to papillary muscles. These muscles and tendons are going to work to make sure these valves stay closed when they are supposed to be closed, so they do not open despite the extreme pressures exerted against them. This is important when we talk about muscle contractions of the heart, the atria versus the ventricles contracting and the pressures involved with that. In this particular class, we're not going to get into too much detail about that, but when you take your physiology class, we will be diving deep into those pressures. We'll talk a lot about them. So these valves are going to open as the pressures change and blood is pumped through them, so from the atria into the ventricles or from the ventricles into the major artery on the other side, depending if we're talking about the AV valves or semilunar valves. As I mentioned, blood in the heart chambers does not nourish the myocardium, so it does have its own circulatory system.